Morning. Happy Monday. I said that one time and someone's like, is there such a thing? We'd love for you to introduce yourself in the chat. I've put the Arizona Employment First webpage for you guys to look at. Actually, I think I gave it to the wrong people. So let me.
Stephanie. Hi. I'm like, she moved.
Good morning, Ivan. How are you?
I'm good.
Good.
So if you want to introduce yourselves into the chat, the other thing is that this is Employment First Topics and Tactics. And it's this monthly series is funded by the Arizona Vocational Rehabilitation, or VR, and promotes competitive integrative employment for all Arizonans with disabilities. There's also a link in the chat to register for upcoming events, our monthly ones moving forward. So if you're not registered for all of them, because you can register for all of them, or you can just register for one, um, please go ahead and feel free to get registered. Thank you for introducing yourselves. That's so great. Again, happy Monday for those of you who are here today, and good morning. I want to welcome everyone and thank you for joining us for this session of Employment First Topics and Tactics. I'm super excited about this one. It's specifically around Social Security supplemental um, security income. I'm not even using the right word, am I, Ivan? SSI and the and how it has work incentives to empower independence and work. And the reason why I word it that way, a lot of times you hear it as like the benefits of work or the impact of work on, you know, Social Security. But I really believe Social Security wants us to work, and I think a lot of people don't know what the work incentives are that they provide in order for people on SSI to work. This will only focus on SSI today. Maybe in the future we'll have one that with SSDI, so look forward to that. Live captioning is available. So to um, and they're here, and we want to also thank the University of Arizona Disability Resource Center for being here today. Also, if you're a member of Family and Community Medicine and eligible to receive DEI credit, we will post the link at the chat at the end of the session. Today is recorded, which means that we can revisit it later and that will be on the Sonoran Center's YouTube later, probably this week. So if you want to revisit it, please feel free. And so I'm going to turn it over today to Ivan Rivera from Ability 360 to talk to us about SSI and work incentives. Thank you.
Thank you, Lori, for actually inviting me. Let me go ahead and see if I can share my screen. Okay, can you see the presentation?
Yes, we can.
Okay, great. So I don't want this to be some formal presentation, but I just wanted to give you highlights of the work incentives. Um, when it comes to SSI, as opposed to SSDI, cash benefits are almost immediately affected. And a lot of people don't understand how and why, and I'll try to explain that to you. Now, a lot of the things that people don't understand is one of the big ones is loss of healthcare benefits, which I like to tell people because it's true that you can only lose your healthcare benefits one or two ways. One is if you are medically recovered, and I'll use, let's say, a liver transplant, for example. You get a liver transplant a year later, there are no more blood transfusions. Your body has accepted the liver, and your doctor has cleared you. That is considered um, medic medically recovered. And the other way is, say, for instance, you're starting to have to pay for your Medicare coverage and you don't pay it. Much like car insurance, you will lose it. So that's the only two ways people can actually lose their health care benefits. So, and I like people to understand that, because there's such a gray area there for people. Two is not understanding the Social Security rules. There's so many of them, and that's why we're here to help individuals. Lack of resources. We know that there are a lot of resources out there. People just don't know how to find them. Um, Learning how work incentives can help individuals to return to work without losing their health care benefits, how to save money and keep those benefits, and how to live more independently. The federal benefit rate is so low, especially with SSDI, or with this SSI. It was never intended for a person to live off of that. It was intended for the person to try to move ahead. Okay, so it's supplemental security income, by the way, Lori.
I know, thanks for that. I had to like, yeah, appreciate the clarity.
Okay, so it's important to know, because I don't know if anyone that is on here actually work with transition age youth, but there is a redetermination at age 18 for SSI, where actually it can turn into childhood disability benefits, depending on whether or not a parent is deceased or retired. And with that, parents, caregivers, they need to start getting documentation very, very early in the process. I would actually say from the time that either the individual um, acquired the disability or just as time goes by. Okay, so SSI is based on a financial need. Um, The federal benefit rate for an individual, as you can see, 967. For a couple is 1,450. That's not a lot of money to live on, especially when you consider that there's a resource limit of $2,000 for individuals and 3,000 for couples, meaning that you can never, any given month, have $2,000 or more in your bank. There is Medicaid that comes along with that, which everybody knows it's access, and it continues as long as one is SSI eligible. So we are a 1619B state, meaning that if your cash benefit decreases to zero, you can still qualify for Medicaid in this state. At no premium, increased medical expenses that are out of pocket may reduce the annual income limit that they're looking at. And there is a Medicaid buy-in, and we will discuss that a little later, which is access freedom to work. So this is how Social Security counts income. So there is a general exclusion of $20. Then you have an earned income exclusion of $65. Whatever the remainder may be is divided by 2, and that is what Social Security considers your countable earned income. They subtract that from the cash benefit, from the SSI cash benefit, and then that equals out the new SSI cash benefit. But I tell people that you have to consider with SSI, if in fact you are working, you're always going to end up with more money. Plus, you're actually paying into the system. So at some point, you may be able to be switched over to SSDI. So
Hey,
this is an
Ivan.
example.
Oh,
Yes.
I just want to mention that I think that's a really great point that you bring up. What the cup two is, I have a saying, it's always you always it always pays to work.
Well,
Meaning, or
you think about it. If you're on SSI right now, okay, and your cash benefit goes to zero, all right. But if you're making a substantial amount of money, then you're paying into the system. So what happens is you're able to use those work incentives once you move over to SSDI, plus you are actually adding to your own retirement.
yes. And I also think that the other thing I think is a myth that families believe is that it's dollar for dollar, and it's not. It's 50 cents
Right,
to the dollar, so to speak, right? A little
right,
bit. Yeah. So I think that's a really good point out too, is once you start working, with SSI, they're not counting your income dollar to dollar.
right.
So thank you.
So if let's say that you're earning $800 a month, okay, there's that $20 reduction, which gives you 780, or then there's that $65 reduction, which gives you the 715 divided by 2 is 357.50, which is now your countable earned income. So when they deduct that from the federal benefit rate of 967, the new SSDI cash benefit is 609.50. But when you consider it, even though the cash benefit has decreased, you're still earning that $800. So if you look at 1,409.50 as opposed to 967, you are earning more money. Now, I do have to mention this before I move over to the next slide, which I probably should make a slide of it, but I haven't. So the problem being, if I am on Social Security on SSI, okay? So right now we're in April. So I get my money deposited on the 3rd of May, okay? So I am required to let Social Security know within a 10-day period, 10 days into May, how much money I earned in April. So the problem becomes people do not understand that because of that delay, at the end of May, Social Security will tell you you have been overpaid. Does that make sense? Because they're behind. So people on SSI will say, well, how come they're taking money? And they're not getting that because Social Security doesn't ask you for the prior month's income until the following month, then the month after that, they're going to deduct what should have been deducted. Does that make sense to everybody?
I think that's a really great point because we lots of people get letters that they've been overpaid, right?
Right.
And then they freak out.
Exactly. This is why people need to know prior to what's going to happen
Hmm.
because they're going to get that letter and they're going to deduct that amount. But knowing this, what's on the screen right now, it doesn't, I guess it just softens the blow a little bit because if you know something is going to happen prior to, you can at least plan for it.
Yes. So are people,
All right,
so
let's Yeah,
So I'm just curious if people are here that are in the chat are hearing it. Oh, there's a new message. So Rebecca says, how do you handle that situation when you receive the letter saying you've overpaid?
they will normally in the letter um let you know. They'll do the math on the letter and let you know, because they'll go through the $20 reduction, the 65. You'll actually see the math on the letter. And it when you look at the math, it makes sense, but the blow is not any less difficult, because the mentality there is still, oh my God, they're taking from 967.
Yeah.
Do you see what I'm saying?
Yeah. Stephanie says this slide is great and provides a good example. And I agree. Um, and so so let's just take this example, Ivan, and we say to the person, okay, you're going to get your paycheck in May, and you're going to report it within 10 days, right? You'll receive a
I'm
letter.
not hearing you.
Oh, oh no, can you hear me now? Oh,
You're coming in and out.
I can hear you okay, Lori.
okay. Can you hear me now, Ivan?
Yes, I can.
Okay. So let's just take this example. I think this is a great example. And then we say we are going to take 10 days to report what we earned in April, let's just say in May. And so let's just say we received this letter end of May. What is it that we should do? Like when we no, what is it that we're saying to people is that they need to save out, they need to know that the next month is going to be the new example and what you also received in May or in
Right.
yeah.
So this is what we do here, is if we sit with someone and because we'll know prior to, with their pay stubs, um, what they've made. So when we sit with them, we show this example to them, and then we tell them, listen, you earned $600. Well, we'll still use the eight. You earned $800. Okay. So they're going to reduce your Social Security income by 357.50.
Mm-hmm.
But you will still be coming home in the month of May with $1,409. It'll be deducted the prior month, but knowing that they're going to be under that 967, they can pre-plan for it. Unfortunately, there's no way getting around, there's no how getting around it. So at least them just knowing that, hey, this is going to happen, you will get a letter.
Yeah.
Unfortunately, sometimes that letter takes a little longer. And that's beyond our control. But so long as that we are letting them know on a month-to-month basis what they need to expect, then at least they're educated about it, and they can say, well, okay, I need to set aside some money because this is going to be lower next month.
Yes, perfect. And Linda Rudd says, very helpful example to teach the importance of budgeting. And Fiona has her hand raised. Go ahead, Fiona.
No, he answered my question actually
Oh,
about are they, how up to date are how current are they is if somebody doesn't report their wages, and so you kind of answered that already.
Yeah, and I hate to say this, but we don't even know what, as we all know, what the future is going to hold. Um, I'm assuming because there are less workers, so that remains to be seen. But in any case, educating the beneficiary is paramount because of that.
Thanks, Ivan. That was helpful. I think that was good to spend a little time there.
And any other questions about that? Okay, so let's go ahead and move forward. Now, with SSI, just like with SSDI, there are work incentives. Blind work expense is one of those work incentives. Okay, if the individual is blind, they can actually, by verified receipts, they can actually reduce the amount of monthly income. So let's say that you took your dog to the vet and you paid out of pocket for it. You don't always, you should keep your receipts, but Social Security doesn't really ask you for them all the time. But this has to be something that the beneficiary has actually paid out of pocket. So you went to the vet and you paid $150 for shots or whatever it may be. You let Social Security know that you went to the vet. There's actually different forms for work incentives. And then they go ahead and they deduct that from the reduction of the SSI cash benefit. Does that make sense?
Yes. And
Okay.
I like to just yeah, so Bill says, I know it's early at this point, but has there been any information with the huge reduction in the federal workforce that may cause extended delays in written letters, which I think you just answered. We don't know yet, correct?
We don't. I will tell you that we actually get, um, we're getting things on a daily basis. And for all of you that can see me, it's doing like this.
Yeah.
So one day they say there's going to be a reduction. Another day they say there's not. Then they say the phone lines are going to be down. Then they say it's not. We just got something else this morning, which I have not read yet, and I don't even know what to expect. So, yeah,
Okay. And Rashina asks, is that reduction dollar for dollar, the blind work expense?
yes,
Yes.
that would be.
Mhm.
So, okay, let me go back. Okay, so they're going to deduct 357.50, right? From that 357.50, they will actually deduct 150. So that would be the amount that they're taking from the SSI benefit is $207.50, because the work incentive was for, or the vet bill was for $150 and you paid out of pocket. And you know what's really bad about this? That the amount of money that is received is not that much. And waiting for that return is the big problem, because it's not like there's money in the bank that you can fall back on. But we try to help them to understand that it's still going to come back to them. It doesn't help them at the very moment, but it is a work incentive and it will come back to them. Does that answer the question?
Yes, thank you. And then the bill also asked, is the blind work expense considered an IRWI?
Yes, it's an impairment related work expense.
Yeah.
But there are different there's different terminology for SSI and SSDI as well. But yes, in general, they all fall into that. And the reason for the blind work expense is because SSDI has something similar but different. Some of these have to do with SSI itself. So I don't know if everybody's heard of an ABLE account. Um, the great thing about the ABLE account is, of course, and there's still legislation out there. They're trying to extend the age of 26. And I believe that there have been some changes, and you would be better off actually speaking to someone that works with the ABLE account. But in general, you can have up to $100,000 in your account, and it will not count as a resource. What's really cool about this is that look at some of the qualified expenses: housing, transportation, health and wellness, education and training, um, which I'm gonna say the education and training, and I'm gonna say this because the thought of the resources, okay? So if you wanted to have an ABLE account and you wanted to pay for education and training, you have a ticket. Why not just go to VR? And you can save what's in your ABLE account for something else, like your rent or food. Do you see what I'm saying? So there's so many different ways that you can, I don't want to say use the system, but use what they've given you and try to sort of pull everything together so the beneficiary can make the best of it. The good thing about is this account is that anyone can put money into it for you. And as you can see, you can use it for rent. It's like a bank account, but for people with disabilities. Pass plan is another is another work incentive. So it allows the SSI recipient to set aside income or resources for a specific work goal. Um, If it is used for the expenses, it will not affect the SSI benefits. And again, some of these work goals are education, vocational training, starting a business, assistive technology. And I do have to say that um, I'm finding more and more that many people, in this day and age, the whole Uber and delivery services, that is considered self-employment. So something like that, they can use it for. So that's something to keep in mind. Student earned income exclusion. Again, I don't know how many of you work with SSI recipients that are under 22, but if the student is in school at least half time, they can go to work without decreasing the SSI benefit. They can earn up to 2,350 per month. The annual cap is 9,460. The prerequisites are college at least 8 hours a week, grades 7 to 12 at least 12 hours, and training classes 12 to 15 hours. Um, I will say something about this that in my experience, and I've had people that Social Security has said no, and I can't say for sure that they are looking at the grades, but I can tell you that I did have one mom that came to me and said, they didn't approve it And after doing some digging, I found that her son was actually enrolled in school, but he was working full time and he wasn't going. That's not the way this works. You have to be attending classes. Plus, in the summertime, if in fact that individual is working, and they are expected to go back to school when classes start again, that is included throughout the summertime because obviously classes are not going. Are there any questions about that?
I just want to say that this is great for summer work, like you mentioned. Um, for people who want to do a summer, get a job for summer work, but are worried about their SSI and their students or young, high school
Right.
students or even college. Bill says this is great information and the pass plan is really effective for members. The one warning I would mention in my experience coaching members in benefits is if the person spends the saved pass plan savings on anything other than their determined goal defined in their pass plan, then it becomes countable income and will be deducted from their following check.
Most definitely. Agreed. Yeah,
Yeah.
it has to be for that work goal.
Mm-hmm.
And let me just tell you something. In general, SSI and SSDI income is not considered income if you want post-secondary education. I don't care how old you are. Okay. So any Pell Grants, if the individual is only receiving a cash benefit, Pell Grants, you will get 100% of those Pell Grants because they don't consider that income. Just as a side note.
So, Ivan, when should someone do a pass plan versus an ABLE account?
Well, okay. An able account, as you can see, you can spend on anything. Much like I forgot who was just um, commenting. A pass plan is for that specific goal.
Okay.
Now, there's some people that they don't fall under the student earned income exclusion or under the pass plan under the
ABLE?
able because of
Sure.
their age.
Right.
So there's that area where you can say, okay, I don't fall under here, but I can use it here. Now, don't quote me on this, but I'm pretty sure you can have an able account and go to VR and help them help you with a pass plan. Oops.
Okay.
That is quite possible. Okay, any questions about that? Hello?
No, I think we don't have any more in the chat.
Okay, I'm sorry. I just thought I closed this out.
Nope, we're still here.
Okay.
We can still see your slides if that.
Okay. Okay, now this is impairment related work expense. I know someone had mentioned that before. Now, I do want to say for the person that asked about the impairment related work expense, it's either the impairment related work expense or blind work expense. You can't do both. And I need to mention that so people can know. And again, these are documented expenses paid for by the individual that will reduce countable monthly income, keep all receipts, and this is not something that Medicaid will actually reimburse you for or that any other health insurance will reimburse you for. Examples, medications, assistive technology, transportation, some transportation, doctor's appointments. There is a long, long list, which we really wouldn't have time to go through all of these lists, but these are just some examples.
I have had people that I work with, Ivan, that can their app for their checklists or whatever for work that they pay for was was deducted as an impairment related work expense. So yeah, very helpful. And so Bill is saying, yeah, Ivan, so the IRWEs or the impairment related work expense, if I am correct, simply reduce the countable income.
Correct.
Correct? Correct.
Correct.
And Fiona says, can job coaching expenses count under an IRWE? So Fiona, do you mean the cost of a job coach or do you mean the expenses of a job coach?
The
Fiona's
cost.
jump Fiona's
Oh.
jumping ahead on my slides here.
Okay. So we're getting there. And then Racina says, can the cost of on-site job coach services be okay? So both of them are asking. So we're going to talk about that right now.
Okay, so that is called wage subsidy and special conditions. They're on the job supports that an individual gets that are given by an employer or a third party. Third party being job coaches. Um, so it may result in pay that is higher than the actual value of the service performed. Now, although you can see job coaching, extra supervision, lower productivity, we can talk about if an individual needs to take a longer break. Um, Depending on the disability, there can be a lot of different things that can go under wage subsidy and special conditions. So if, and I'll just throw this out there, if a person actually has to take an injectable once a day and they have side effects, and those side effects, may take an hour or so, that can be under this. Again, the list is so long. Um, these are just some of the main ones that we try to put in here. Now, when we work with individuals, it sometimes it gets a little interesting because the information that we provide, we try to get as much information as we can. And some people are a little leery about giving out information about their disability. Um, we try to establish that relationship so we can give them as much information as possible, especially with things like this, because if we don't know what to tell you about it because we're not going to go through a list, and we can't go through a list of 100 different things that can fall under here um, without knowing some of the person's special needs on a day-to-day basis. So expedited reinstatement. If a recipient, an SSI recipient, stops working as a result of their medical condition, they can restart benefits without reapplying. Um, they must continue to meet the medical definition of disability and not earning over a certain amount of money. They can start receiving benefits for up to 6 months until they actually make their final decision, and it is available to up to 5 years after one's benefits end, meaning the cash benefit in this case. The rules are a little bit different with SSDI.
So Ivan, can we walk through this? Because I think this is one that I think a lot of people don't really realize, but that and it kind of goes along with what we hear a lot, which is it took us so long to get it. I don't want to lose it. I'm not willing to work to, and then we're going to lose it. And one of the things, so if we were to just take Joe and he's 26 making the $800,
Right,
let's just say, okay?
right,
And he continues to meet the medical definition. So let's just make all those assumptions, you know. Explain how this works. So if he's working and he stops, he gets laid off, let's just say, or it's not working, because of a medical, like because it was, too overstimulating, whatever it
Right.
is. What happens next?
So, okay, let's back up a little bit.
Okay.
Joe would have had to have lost his whole cash benefit.
Okay, so he was doing great.
Right.
He
He
was,
was
yeah.
off cash
Yep.
benefits. He was still getting his Medicaid.
Right.
And then something happened and he has to stop working.
Right.
Okay. So with SSI beneficiaries, so let me mention this first, is that depending on the disability, and I hate to say it this way, but it is what it is. There is a book out there that states if I lose my ring finger, it is worth more than my pinky. Okay.
Okay.
Same thing with Social Security. Depending on the disability, it could take longer for that initial okay when you're signing up for Social Security, not expedited reinstatement. So if if I have HIV, I'm more likely to get on there quicker than somebody that has an SMI because the HIV is a tangible diagnosis, whereas the SMI, it's going to take a lot longer for them to figure out the severity of it. Does that make
Mm-hmm.
sense?
Mm-hmm.
Okay. So once you have actually started getting your benefits, they already know, and SMI is hard to say also with mental health because that fluctuates. So I shouldn't go there. But once Social Security has established that you have a you're legally blind or you have um you're a chair user, then the reinstatement part of it, they have already established your disability. It's just a matter of do you still have the disability?
Mm-hmm.
So the redetermination doesn't take that long, and so long as the individual is still seeing their doctor or doctors or their caregivers or whoever it may be, um, to be able to actually say, yes, this person is still disabled, then there's no worries.
Okay, so Fiona says, so you are saying that expedited reinstatement applies to individuals who lost their cash benefits, not necessarily those who lost their medical.
That is correct because, and j- is that Fiona again?
Yes.
Oh, Fiona, that's my
She's
next slide.
okay.
Okay, but yes,
Okay.
in fact, that's what I'm saying.
Okay. And then Ivan saying, I mean, it's Bill saying, Ivan, please clarify, does expedited reinstatement apply to both SSI and SSDI? For some reason, he thought it was just DI.
No, it's both. It is both.
Okay. I'll let you
Yeah.
move on to your next slide with saying
Okay.
with Fiona. But yeah, I just think this is really important. This is an important piece because um
Let There's something else that I want to mention that I don't have in any of these slides. Okay. And it is for Medicare and Medicaid alike. If an individual, we're going to go with SSI and Medicaid. If an individual has Medicaid, okay, and they have decided that they're going to go the holistic route, they will take your Medicaid away.
oh, so like if I want acupuncture, is that what you're
That is
meaning?
correct.
Okay. Okay.
Because these benefits are for individuals, like, for instance, I had, and it's an SSDI case, but it's not any different. I had an individual um, that had mental health disabilities, and she decided that she had Medicare, and she had decided she was going to go holistic, and it was working for her, and they stopped her Medicare because they noticed that she wasn't using it. And in their minds, that's a waste of Medicare when we can give it to someone else. So just bear that in mind when you're talking to people.
Okay, and we're at 45 minutes. I mean, we're at 10:45, just so you know.
Okay. Access freedom to work. Medicaid buy-in provides health coverage to working people with disabilities who actually are earning too much for access, or in this state, Medicaid. You have to be a U.S. citizen or qualifying non-citizen, 16 to 64, blind or disabled. Obviously, you must be working, and you can earn up to $6,360 per month and not lose your Medicaid. So, if you're working, you lost your cash benefit, you can still, because we're 1619B, you can switch over to the access freedom to work and keep your Medicare, your Medicaid. And I can tell you that that $35 premium, oops, that $35 premium, you would actually have to be earning somewhere that amount of 6,360, and with an annual salary of 76,000 plus, that shouldn't be a problem.
And I just want to say this is state specific. So thank Arizona State, because this is such a great thing that the state does. And I
Right,
also want to clarify too that this is the number one worry from families, is that they will lose their health insurance.
right.
A lot of people are wanting to work, and when the data shows it's not really the SSI. I mean, it is, but it isn't, right? But really what their biggest concern is about losing their Medicaid. And so for those of you who are on here, this access freedom to work, this is very important for families and for individuals that want to work. It's such a great thing the state does.
So, ticket to work, if you're 16 to 65, you're eligible for a ticket. I will tell you that you can only assign your ticket to either an employment service or vocational rehabilitation, not to both at the same time. It's very important that you let your beneficiaries know they need to know what they want first. All ENs are different. Some of the VRs are different. They will offer different services. So it is important for the beneficiary to check first. So we're benefits to work. As you know, we help people that are on Social Security transition to work. We are all certified. Um, we offer personalized services for every individual. These services are free. Now, because of the amount of people, there are four of us that actually um, serve people throughout all of Arizona. Many of the other states have a lot of different WIPAs. We're the only ones in the state. So at this point, if you're currently working or engaging in self-employment, have a job offer pending. If you're transition age youth, 14 to 17, um, and those who are 18 but haven't completed their adult redetermination, veteran, age 14 to 26, are receiving services from vocational rehabilitation, employment network, or could be mental health facilities. That is, you fall under that. For individuals that are just considering working, we do monthly workshops. I have separated them to one workshop for SSI, one for SSDI, and another for they can actually sign up for both for those individuals that have concurrent benefits. Um, they can attend in person or virtually. They can actually register They can call to register, or I actually have flyers that have the URL so they can actually sign themselves up, and I instantly get an email that they have signed up for that class. So,
Ivan,
yeah,
would you mind sending that, and then I'll send it out to all the attendees so that
I,
people have it?
I was going to suggest that. Yes, I
Yes,
will
and
do that.
oh, and there it is too. So, and then the other thing is Rashina wants to know is what is the time frame of the ticket?
There is no time frame so long as you're under, it's right before you turn 65.
Right before you turn 65. Oh,
Yes,
yeah.
they say 64, but it's to the
Right.
end of your age of 64.
Okay, and then Fiona's raising her hand, and then Stephanie says part of competitive integrative employment is obtaining employment that includes access to benefits through the employer. What would be the incentive in this case of enrolling in your employer's benefits as opposed to remaining on Medicaid?
Good question. And I'll try to be as brief as possible. I was on Medicare and on Freedom to Work since 2014 when I started working. In 2022, when I had to start paying my Part A, then what happened was my Part A Medicare. It turns out that between my Part A, Part B, and my Freedom to Work, it was a lot more money than my $3,200 out of pocket for my employer-sponsored health coverage, and a lot more of a pain in the neck.
So, yeah, so it's dependent on how much the employer's covering for benefits and the cost is what you're saying.
That
Yeah,
is correct.
yeah. Okay, Fiona, go ahead with your question.
Going back to employment networks, can you talk a little bit about how it works? Say somebody was working with VR and we are looking at using the employment network to provide job coaching for that individual after VR services end. What are the requirements around that? I was helping one individual and I'm a little fuzzy of what the requirements are. Is there an income requirement like
No, no,
or
there's not. But just remember that some of the employment networks will only accept people that want full-time employment. So they're so different, but just to better answer your question, in order for that person to go to an employment network, they would have to close their ticket with VR and then reassign it to an employment network.
right?
Unfortunately, they can't do both at the same time.
Right. Okay. So there's no limit, but some are requiring full time. Is that kosher?
It's really up to the employment network.
Okay.
Yeah.
See, I had one case where the employment network was saying the person wasn't making enough for them to support them to provide job coaching. So I was just a little fuzzy on that.
Like I said, they have to make sure that they do their homework because they all have their own guidelines.
Okay. Thank you.
Okay. So um they can call the tick if they want services from us, they can call the Ticket to Work line and request a referral, which is then sent to us. They can call us directly. If in fact they just and for the sake of today's presentation, if you have any questions, the email b2w@ability360.org is actually manned by me, so to speak. So I get all of those inquiries, and I'm the one that fields all those inquiries. Otherwise, my intake specialist actually assesses what the consumer may need. And that is it.
Great. Any more questions? I really appreciate the dialogue and the conversation. I will say that I did see Bill did say that he wants to express his gratitude to Ability 360 and the benefits counselors out there. My next statement is not meant to be negative, but my experience with individuals I have helped, the SSA staff office are either not trained or not willing to help walk members through these benefits programs typically refer the person to the SSA national website, which is disappointing. So we're privileged to have an Ability 360. So
You
thanks.
know, I want to mention something about that because purposely, I tell people, this is the information I'm providing you. Should you not believe it, you can call any of the CWICs and they will tell you the same exact thing. If you
Mhm.
call Social Security today and you get one person, you get somebody else tomorrow, you get a completely different story. That's why we're all trained the same way.
Yep. And then Rashina says, does Ability 360 assist with clients' understanding of long-term disability benefits and Altex?
We have people that that
Do.
yes. We have a lot of different programs. I will tell you that some of our programs start as early as, I think it's 4 years old, where they teach them how to swim. And we have programs way into past retirement. So yes, we do actually have an all-text person um, that can help with something like that. We also have an information and referral person. Her name is Trish, and anything outside of the benefits to work, because we're so big, I don't know that much about it, but she is awesome. And what I can do, if you'd like, Lori, I
Hmm.
can go ahead and send you her contact information. She's only here Tuesdays and Thursdays, but I can send you that along with the uh, with the flyers.
Fired. I think that'd be great. And I'll be sure to send everyone a follow-up email this week on Ivan's flyer for his um, classes. I'll also put it on our Employment First website where we have the events and the handouts, but you'll also be getting an email. So, Ivan, thank you so much for today. I want you to know we really appreciate that.
Thank you. It's it's a lot, and I think with what's going on with, I'll say, the current administration, I think we all need sort of something to hold on to, and something that's a little more there so we can see it, because we don't know what's happening. So thank you so much for letting me be here.